Dr. Vicki Peterson here. Today a patient came in to see me. She was a new patient and she was suffering from some neurological problems. She was almost 62 years old, and after seeing many doctors, having a lot of different diagnostic tests, the summary that was given to her was she was getting old. Now, this is a woman who has enjoyed very good health. Yes, the passage of time is of course occurring, but I don't consider 62 old. As a matter of fact, when you assess, many studies have been done on looking at the longevity of organs, looking at your token heart, liver, lung, etc. From the viewpoint of how long are these organs designed to last? What is the longevity of our organs? And study after study comes up with the answer of about 120 years. So if our organs are designed to last for 120 years, at 60 they should just be getting warmed up. In other words, I think that's a ridiculous diagnosis. And then later in the day I was reading a research study. It was from not quite a year ago, and in this study neurological problems associated with celiac disease were assessed. And there was a number of different neurological problems looked at. There were about 75 people that took place in this study, and they filled out a questionnaire. They had a neurologic exam, and some of the percentages were that 35% of the people had psychiatric symptoms like depression. Another 35% had proprioceptive problems. So proprioception is your body's feedback mechanism from parts of your body to the nervous system, so you know where parts of your body are at any given time. So your ability to close your eyes, touch your nose, that's proprioception. But 35% of this population had proprioceptive problems. 28% of them, so more than a quarter, suffered from migraines. Another had gait issues, so ataxia, not having a steady gait. 20% had carpal tunnel problems, and 8% suffered from dizziness. A lot of different neurological problems that are quite common and quite debilitating when people have them. So what happened with this particular woman, getting back to the new patient I was talking about, is she had the myriad of tests. They all came back negative. She did not have a tumor. She did not have MS. She did not have anything that someone could put a diagnosis code on with a nice little label, and because it couldn't be packaged just perfectly, she was told she was getting old, or perhaps she was under stress and had already been offered a psychotropic drug to handle her stress, which she smartly refused. So what is my point here? My point is that we're really missing the boat on a lot of these neurological problems. It has been very well established that second to digestive problems, gluten affects the nervous system more than any other system. I just told you a number of percentages in a group of people, but there's study after study after study. There's a tremendous amount of studies that show that this association is there. Now, this particular study kind of was a little confusing at the end, because they said, well, there's no pathogenesis, meaning there's no actual disease that they could see with the nervous system problems. So it was more, and they correctly said, in my opinion, inflammation. And that's what we know to be the case with gluten, is that the immune system gets inflamed because of the gluten, because of the leaky gut or damage to the intestines. Then that inflammatory response goes out into the bloodstream and secondarily affects the nervous system very strongly. So we know the mechanism, we know it's there, but a lot of people suffering from these problems do not know this mechanism. And although we do a lot of different things in our clinic, we're definitely getting known about the gluten connection with us. And sure enough, this woman said, I don't think I have a gluten problem. and the next very common remark, I couldn't live without gluten. I said, well, don't be hasty. Let's just find out for sure. And maybe she has a gluten problem. Maybe she doesn't. I don't know yet. But the point is that we see this over and over and over again. And lastly, there's a very good reaction that we see when people eliminate gluten from their diet. And sometimes it's very fast. Sometimes it's so unbelievably quick and easy. you just sort of throw up your hands and say, wow, it's nice that something can be that easy. Sure, sometimes it takes a longer period of time, but do let others know, because these are a lot of very common problems that are afflicting millions of Americans when taken together as a total sum, and there's no harm in trying a gluten-free diet. So I hope this was informative for you, and until next time, I wish you very good health.